Hey, my name is Gina. I'm a registered dental hygienist and a proud Burst ambassador, and you are watching Burst TV, so thank you so much for being here. A while back, I made a video with some tips on what to do after you get your tooth extracted. You had some questions and comments on that video, so today what I'm going to do is answer some of those questions for you. So that first question was about the blood clot after your extraction. Specifically, the question was, is it a natural part of the extraction, and how long does it stay in place once the tooth is actually extracted? A quick note on blood clots. Basically, your tooth is extracted and there's a hole the size of your tooth, and it's your body's immune system responding by covering up that hole with a little blood clot. It does it to stop the bleeding. Really as simple as that. It's your body's first response to the procedure. That blood clot also protects the tooth socket, and it's the first step in the healing process. So yes, it's a natural thing, and it happens within 24 hours after your tooth is extracted. We want it to stay in place for about 7 to 10 days after the extraction because this gives your body the time to heal, form new bone, and form new tissue in that area. This person did spit out water several hours after the extraction. They're asking if that's okay. So the short answer is no, it's not great, and hopefully nothing happened and everything was okay, but generally you don't want to spit, rinse, use a straw for at least the first few days after your extraction because it can cause that all-important blood clot to loosen, which in turn causes a dry socket, and it can cause severe pain. But if you're that person that accidentally spit water out, use a straw, whatever, don't panic. It doesn't automatically mean a dry socket, but it does put you at higher risk, and that's why we don't recommend it because we don't want the blood clot to loosen. So monitor the situation. If you're feeling pain where the pain was subsiding or it was getting better, now the pain's getting worse, that is a sign that you should call your dentist. So what you want to do instead of spitting and rinsing is gently let water just dribble from the side of your mouth. Yeah, it's awkward. I realize that, but it will save you the pain of a dry socket. And personally, I think it's worth it. So just a little dribble, okay? Next question was, is it okay to have soup after the extraction? Warm, not piping hot soup is actually a great option. Personally, if you watched the last video, I recommend ice cream, but you do you. So just one thing, make sure the soup doesn't have very small components to it, like grain of rice or something else that's really tiny that can get lodged in that socket. You know, you'd want to avoid that. So chicken noodle soup, that's fine. So this person, they had an extraction over 2 months ago. The gums are taking forever to close. They're still looking red. Why is this, and can they chew on both sides? So one thing that might not necessarily be mentioned at your visit is that immediate healing to the point where you shouldn't really have pain, that happens within a week or so. But the full healing process, it can take months, and it's totally natural when you have a tooth extracted, especially if it was a pretty large tooth with multiple roots like a molar. There's a hole there. It takes your body a while to completely fill in that space. A good comparison for the healing process after an extraction might be the mending of a broken bone, for example. Just like a broken bone, it needs some time to heal and regenerate. The socket where the tooth was extracted, it also needs time to heal, right? Because there is bone growing back in, there is new tissue filling the space. So yeah, it can take a little bit. As far as chewing goes, I'd recommend avoiding that area for probably at least a week or two because you don't want to accidentally hurt it. You know, we probably want to avoid chips, things that are really sharp in that area because you want to let it heal. As far as redness goes, sometimes patients come in even weeks after their extraction and I see them in my chair, and honestly, I'm even a little bit surprised or second guessing as to whether the extraction does look okay, the site, because it can look reddish, it can look kind of whitish, but as long as the patient's not experiencing pain, if there's not swelling, that area most likely is okay. If you have specific concerns, if something looks off, if you're having pain weeks after the extraction site, call your dentist because they should be able to get you in, have a quick post-op consultation, check the area, and then you can have peace of mind. Thank you so much for watching Bruce TV. We come out with new videos every single week. So if you have questions or if you have anything specific that you would like to know about, leave it below in the comments. And also don't forget to like, subscribe, and you'll get notified when we respond or when we make a video so you don't miss it.